Hello, guys. My name is Dr. Hamilton, also known as Dr. Silvertongue online. And thank you for following my series where I go to patients' houses, do house calls, treat their symptoms, and get them better and promote health. So today we do have
Vicky.
So Miss Vicky, what's your story?
So I'm a nurse, and when I got into healthcare about 15 years ago or something, I first started working off as a nursing assistant where I worked at a nursing home and I used to have to lift patients a lot. Lifting significantly over 50 pounds was kind of the limit of safety where you have to start using lifting devices nowadays. So when I started, California had just passed a law that like people from doing that at work, but it was right before they implemented it, so I was still having to physically lift people, and I injured my back doing that. It's muscular. I've had MRIs, x-rays initially. It took me a long time to get the MRIs because our medical system, but I finally got the MRI just to make sure that I didn't have any like bulging discs or anything structurally, right, that needed to get addressed before I could really focus on doing the therapies that I needed to do to heal myself. So it turns out it's really mostly muscular and inflammatory. The original injury was lower left in the back, a shooting sensation after I was done lifting. And I thought I was using proper technique at the time. I guess not. But anyway, I actually did do therapy at that point to a chiropractor as well. And it did help. 6 months after, I just started to have pain develop in that area, and honestly it slowly progressed over time to my upper back shoulder area. And so I tend to have like pain here on the trap, a little bit on my lat now, in my mid back, and I know that because those are all the areas where I do a lot of pressure like relief. I sometimes think my piriformis is messed up, and I think that my ilio like sacrum is unstable. I discovered that through snowboarding because I can't snowboard anymore. It puts too much tension in that area. And I also have pain on my quad, on my left quad a bit. Occasionally it does do a neuropathic type pain.
So they didn't find anything in the MRI?
Oh yeah, they did. So mild, like a mild scoliosis and like some degenerative disc stuff that was really insignificant, right? So nothing major.
Do you have access to that imaging at all?
No, I think yeah, I might be able to get it, but not right now.
Yeah, sure. You can always show me later on.
Yeah.
'Cause I'm curious about that. Okay, is there anything else that makes it worse?
I feel like immobility makes it worse in my case. The therapies that I've done to help me are like stretching, so lots of yoga, weightlifting has actually helped, like just core strengthening. And so I feel like the more active I am, the more I take care of my body, the better I feel. The less I do, the more immobile I am, the more like pain I feel. I've also done PRP injections as well. A few years ago, my lower and my upper back, that was done by orthopedic doctors. I had done a lot of research on the benefits of PRP. Like it's evidence-based to actually help. And so I did try it, and I did notice that it shrunk the area of radiating pain. Like imagine my back area here, I have this deep, like sharp circle of pain. It slowly radiates out a little bit. When I started to do that therapy, it like shrunk in a little bit more. So I did get some relief from it.
All right. So what would you say your pain level is out of 10? 10 being the worst.
I say sometimes 3. It's like a 3 to 5, but that's tolerable for me. For me to be uncomfortable, I have to be like at an 8 or something or more.
Let's do a little bit of range of motion.
Okay.
So what you can do is you take your chin, you can bring it to your chest. Pain or tightness with that?
A little tightness, but I honestly like this. This is a good stretch for the pain I have right here.
And you can look up in the sky. How's that?
It's good.
Okay.
Yeah.
And what you could do is lean to the side.
Like neck or just all myself?
Just like that. And you can do the other way. You come back to the center. You can look to the side. You can look to the other side. Okay. All that felt okay? All right. So you can stand up and lean over to touch your toes as much as possible. Any pain or anything with that?
No, just a good stretch.
You can come back up and then arch your back as much as possible. How's that feel?
Good.
Okay, come back to the center. You can lean to the side. And then lean to the other side. That felt okay?
Yeah, I notice more on the stretch going towards the right.
Okay, it's tight.
What I feel when I do all those stretches is I can tell that muscle is injured and it's getting some relief from the stretching
Yeah.
itself.
So what you could do is you could twist the other way. I'm just gonna feel around. That's really restricted right here. Feel that?
Yeah.
Let's see about this one right here. This one right here too. Okay. Yeah, I'm looking at the pattern. See, it looks like the way it's coming down, your spine does come out this way. You can also see that the right shoulder is a little bit higher. You're like this. Tell me if this makes your pain better, worse, or about the same. So I'm just gonna press into the head.
The same.
Okay.
Yeah.
I'm gonna lift it up.
The same. That's good. It's okay.
Okay.
Yeah.
And we'll go this way. I'll bring it back, and I'll press it in.
Hurts a little bit
Okay.
over here.
On that side.
Yeah.
This way. I'll bring it back.
This side's okay. Yeah.
Okay. All right. Let's have you go back on your stomach.
Here?
Yep. Okay. Just gonna check the legs. So I notice that your right leg is slightly higher, and that does correlate with the scoliosis. And you can see how, because this is really tight right here, it's basically hiking it up. Can you actually lay face down?
Like on this thing?
Yeah, you can lift your head up.
There?
So,
Tickles.
motion down here. Okay, let me know if what I do increases your symptoms, decreases them, or if it's about the same.
Okay.
So I'm just gonna lift this up.
Same,
Okay. How's that?
same, but it's a good stretch. That one feels a little weird, but not increases my pain a lot. It just feels different.
Okay. Let's have you go on your back. Okay.
No, just tightness.
Okay. And do this right here.
Just tightness.
Okay.
Isn't that the sciatic nerve one? Isn't that the one that triggers the sciatic nerve?
Yeah.
Yeah.
There you go. What do you do for work?
I'm a nurse. Yeah.
That's why she knows that.
Oh, I forgot I have the mic on. Yeah, I was trying to be all quiet.
Exposed. No, I'm just kidding.
No.
So you can keep both your legs straight, and while keeping both your legs straight, what you want to do is at the same time lift them 6 inches off the table, and then you can lower them. How'd that feel in the low back area?
It was okay, but I was trying to tighten up my core. Do a lot of ab stuff.
Right. And you can face that way.
I actually didn't pick that up from nursing because of my back end. Just done a lot of research, so like I try to be informed about as much as I can on this whole situation.
Yeah. When's the last time you've been to a chiropractor?
I think a couple years, right around the same time that I was doing the PRP injections, because it was at the same office.
What office was that?
Beach City's Orthopedic.
Down the street. Okay, so this is your spine. Maybe they explained this to you last time you were in the chiropractic clinic, but this is the front part of your spine,
Uh-huh.
and this is the back part of your spine. So yeah, you do have tight muscles like in the neck and the low back, but the real question is what's causing that? Like, why are we dealing with that?
Right.
Because people get massages all the time and they feel really good,
And it goes
and
back.
so there's a disconnect because
Yeah.
if it was just a tight muscle, then that massage would have done the work. Which
Right.
a lot of times massages do the work for quick things. You just injured your muscle and people feel so much better. This is front part of your spine. This is the back part of your spine. What you have is known as a spinal cord. Starts in the brain, and then from the brain is the spinal cord. Off of the cord are these yellow things, which are the spinal nerve roots. And what can happen, and what feels like is happening within your spine as we're going down, is it feels like things are just misaligned and shifted out of position. Once things get shifted out of position, a lot of times we can get impingement on nerves, and it's not a fun time.
Yeah, I know. So I'm laughing because that's the word I was thinking in my. He's gonna say impingement. Yeah.
Things feel misaligned, but also you can get tightness, weakness. Sometimes we get numbness, tingling. They do go to the organs and tissues of your body. But with that, what we do as chiropractors is we take these vertebrae that are misaligned, and over time we retrain them more and more back to alignment so things can heal better. And then just straight chiropractic isn't necessarily enough. You got to do more than that. You got to strengthen your spine because ligaments do have memory. So the more we shift it back into position, you got to strengthen it. And we keep doing it. Every time we shift it, we strengthen it more. And then eventually we maintain things fully. And then we'll strengthen it there.
Okay.
This will be your first session. Any questions before we get started?
No, that makes total sense.
Have you go on your stomach.
Okay.
We'll start off with a little scraping. I'm sure you're familiar with it.
Oh, yeah.
With menthol. You should start paying me at this point. I should reach out to them.
I know, right?
All right. So this is BioFreeze. This is not an advertisement. Menthol. Really good for pain. Really good for tightness. Really helps loosen things up. Would you say it's worse in your low back or your neck?
It's about the same everywhere now.
We can quickly do both. I'm just going to roll this down a little bit.
Okay.
So,
I actually like that.
okay, good. Yeah, a lot of times it can be really uncomfortable in the
Yeah.
moment, but then once you're done, you're like, oh my gosh, I feel amazing.
It's funny, mostly on my left side. On my right side is definitely more sensitive, so it can't take as much. But on my left, like if I'm getting a regular like shiatsu massage, I'm like, what are you doing? This is nothing. And on my left, I'm like, you need to dig in there.
You need to get way more in there. I understand that. No, I had a massage one time, and she massaged me for about an hour. And she just talked to me about her life. And by the time it was done, it's very awful. Like, didn't use any pressure. I was halfway through. I was like, can you use more pressure? She was like, this is not a deep tissue massage. I was like, oh, okay. Oh. You're literally just like doing this.
Yeah, I'm good.
It just felt like more of a therapy session for you.
Right.
And then what we can do is... we'll get to the neck.
If I have a sports bra on.
Okay, good. We'll have you face the camera when we do it too. I'll just do it seated. It's probably easier to do it seated. Okay. So we're just gonna work the trap. What kind of nurse are you?
ICU.
Do you ever watch medical shows?
Yeah, that's what got me into healthcare. I used to love watching like the reality TV ones. Emergency 911, I used to love watching that one. The surgery show, Dr. 90210, like just all that stuff was like just so cool to me.
You ever watch The Pit?
I can't watch The Pit.
Why is that?
Because that shit's too real is what I hear.
It's pretty intense.
Well, because I've worked in the ER as a tech, so I know, and I've seen snippets of what people are posting about what it is, and I'm just like, yeah, that hits a little too close to home. It's like I do that for a living, so do I really want to watch it on TV? I don't know. I feel like one day I will. One day I'll watch it because I hear it really does medicine justice, so it's cool.
I saw, but I didn't finish it, to be honest, because it was stressing me out.
I know, right?
I was like, it was so much going on.
Yeah.
Like
I just couldn't start it because it was already stressing me out.
Let's have you go on your stomach.
Okay. Okay.
And first we'll start off by stretching your legs. Whenever your hip flexors, because your quad attaches to your hip bone, and that also, your hip flexors attached to the back part of your very first two lumbar vertebrae. And whenever those are tight, it can pull on to those and cause and contribute towards those misalignments. So it's really important that we have those hip flexors that are stretched out properly.
When you're pulling up the leg, the hip flexor on the opposite leg is the one that's getting the stretch. It's nice. I like it.
So what I'm going to do is, this is known as a cervical thoracic move. It's where your neck turns into your mid-back. It helps shift it back into position. So what I'm going to do is do this one right here. There we go. Look at this one right here. Let's have you go on your side, facing towards me.
On my side?
Yes, ma'am.
Towards you.
Bring this up. There you go.
Okay.
Come a little bit closer to me. Let's relax this hip. And take a deep breath in. Breathe out. Nice. Whew. Other side.
I felt that one more on my upper shoulder area. Usually it's the lower lumbar.
There you go. Come a little bit closer to the edge. That's good. Just don't want your knee hitting the table.
Yeah, you're good.
All right. Take a deep breath in, breathe out. Already moving. There we go.
Oh.
And let's have you on. You're on back. Let's see.
Okay, what am I doing now? Sorry.
We're just gonna stretch out the hamstrings because that can also contribute towards pulling onto the pelvis region.
Can't remember the name of that damn muscle. I'm spacing out on it.
Which one?
That one that's
Iliopsoas.
yeah, there you go. That's the one.
It's actually my favorite muscle. That's actually the muscle that got injured that inspired me to get into chiropractic because I damaged it pretty badly. I sprained it from running, and I did cross country, but also did track, and I sprained it. But I was very stubborn. I didn't want to stop.
Oh.
So I kept doing it until it got worse and worse, and then it got to the point where I went to PT and ortho, and they were like, "You should stop running completely." And I didn't want to, so I ended up going to a chiropractor, and he got me better, out of pain in 30 days. I was able to run within the next 30 days, and then by that third month, I ran the fastest time that I've ever ran. And I was like, all right, I gotta spread the word of chiropractic and figure out what this is. So, and I shot at almost every chiropractor within that region of the East Coast. Delaware is where I'm originally from. So.
Delaware. Oh, wow. I think you're the first person I've met from Delaware.
Yeah. I'm usually everybody's first.
You ever remember Wayne's World?
Wayne's World?
Yeah.
That was in Delaware?
No, but they do the scene where they do the postcards in the studio that they're in, and the back screen or whatever has the postcards, and then Garth is they're both talking about going to different places, and so then Delaware shows up, and then Garth just looks at it and he's like, Delaware.
Actually, I think I remember that.
You should go look at it. It's hilarious.
Because I think it was on Comedy Central. It would be on, and I would just never watch it.
Oh, dude, that was mine and my siblings on repeat movie. It was hilarious.
All right. Get some inspiration. Come down a little bit, down to the foot of the table. This is going to be for your mid-back.
Yeah.
So what we're going to do a big hug. There we go. And then what you're going to do is going to take a deep breath in, and then take a deep breath out.
Oh.
Nice. All right. And what we'll do is we'll stretch out your neck a little bit. So we'll stretch this out. And what I'll have you do is shrug your shoulder up towards me with all your strength. And relax it. Do it again. Relax it. gets to your levator scab, but also your upper trap region as well, especially on that left side. It's tight on that region. So you can do it again on this side. You relax it.
Oh, no.
I reflect back to the shiatsu massage that you were talking. She likes it rougher. You said more?
Yeah. Yeah, that hits the spot right there. Oh my God. Yes.
Okay. And now we shall move thy neck. Let's see. This one right here.
Woo!
Nice. This one right here. Let's do it one more time. There we go.
Boy.
It's been a couple years since that last adjustment, so I'll give it some time before you get up. Let your nervous system adapt.
Okay.
Later today, you may feel really amazing. I wouldn't test it
Yay.
out. I wouldn't do anything you're not normally used to. You also might feel worse.
So dancing is okay?
If you usually dance,
Yeah,
then you
usually-
should probably
I
do
usually
it.
dance.
Don't start
Yeah,
doing
no,
other
no,
things,
I know,
backflips
I
and
know,
all
I
that.
know.
But yeah, dance is good. What kind of dance do you do?
I just dancing to like house music and stuff.
I was at a house party yesterday.
Oh,
That's
yeah?
a different conversation. Yes. If you do feel worse, that's normal. It's like working out for the first time in a really long time. Those muscles are getting stretched out.
Yeah.
But what I would have you do is basically ice it down about 10 minutes per hour as needed if you feel any soreness
whatnot, yeah.
anywhere.
Lots of water. Cool.
I'm gonna have you face that way. And I'm gonna do one last move. This is gonna be for your neck. And this is called the occiput. So really get this area. Look to your left.
Ooh, the occiput. Okay, sorry, I like that.
Oh, you
part.
got it? You
Yeah.
got it before? Oh.
The occipital bone.
Yeah. Oh, you just like the word? We're gonna like the movie even more.
I'm like, you're talking to a nerd
Yeah,
here.
I do. Yeah, I like it too. Yeah, it's kind of cool.
Okay.
I
alright.
know what you mean though.
Okay, I did like that, how it felt though. I was like, oh my gosh, you're like, yeah.
Let's do range of motion now. So let's look down as much as you can. Look all the way up. And come back. Look to the side. To the other side. And you can look forward and you can lean to the side. Other side. Okay, how's that feel in the neck area?
Good.
Okay. You just stand up. Lean over, touch your toes. And then you can come back up. Arch your back towards the ceiling. Come back to the center. Lean to the side. Lean to the other side. And then you can twist to the side. Twist it the other way. Okay, you did that a lot more gracefully. Does it feel looser?
Yeah, no, it's nice.
Okay.
Yeah, I
All
like
right.
it.
Okay. Thank you for following my channel. Tune in next week for the next house call. And we'll see you soon. Bye.